first. Do you feel that there is a place for manual therapy in regards to, we'll just keep it at the shoulder?
Simply put, no. I have abandoned manual therapy. As you may have read, if you read some of my blogs, I've abandoned it completely as a physiotherapist. I am not going to say everybody has to abandon it. I mean, everybody thinks I'm on a mission to get it eradicated completely. I think I am misinterpreted on my position on manual therapy. It is just that I have been disillusioned with it over the years. I've felt I've wasted a lot of time, money and brain power on something that's just not important. So that's my position. So I think physiotherapists are better than manual therapy as well. I think your skills, your education, your training, it needs to be better used elsewhere other than giving massages and poking a few spines and joints. Now, that's not to say it doesn't do anything. Again, this is the misposition I get a lot. People think, oh, Adam says that manual therapy doesn't. Here's a paper, here's a systematic review. I know it does something. But then again, when you're dealing with pain, shitloads of stuff does something. I throw back a paper at people whenever they give me a shitty little case report on manual therapy doing something. I often throw back a paper that shows swearing improves tolerance to painful stimuluses with a much bigger effect size than any fucking manual therapy does. So if you're going to start playing that game of here's a case report or here's a little study that shows, this, I'll go, well, there's one there that shows just by swearing, letting out a few F-bombs when you're in pain, improves your tolerance to pain. So anything can help with pain for the short term. And that's exactly what manual therapy does. If it wants to be used or a patient's got an expectation that they want it, that's fine. I think they're entitled to have it. Pain alleviation is something that's a right, I think, that people should be entitled to have. I think people rush for it too quick. I think a lot of people have lost tolerances to painful things that just hurt. And they need to learn to endure and tolerate some painful stimuluses and be a bit more resilient behind it. But if they want manual therapy, they want a massage to help their pain, I think they're entitled to it. But I don't think a physiotherapist should be applying it at a premium. They can go and get it from a masseuse. They can go and get it from a beauty parlor. They can go get it from someone at half the cost and probably get twice as long for it and probably feel a shitload better than a physiotherapist applying it with a nice room with a bit of whale music and a candle light going on in the background. That's how manual therapy needs to be used.
I won't beat this horse because I don't perform manual therapy currently either in my practice for many of the same reasons that you. So there's nobody. There's not a third, and there's not a third person on the show to kind of like give the other side. So I don't want to just make this a manual therapy bashing deal. But I think it was on one of your blogs where you said the most skilled manual therapy I ever got was from my wife or my girlfriend, or like that's like with no training at all. It's just and what you mentioned there is exactly what I say. People will ask me, well, what do you think about massage? And I think, well, I think it'll relax the hell out of you. I think a nice quiet room, a dark room, nice music, somebody cares, and that therapeutic touch. Like there's something to that, but for our purposes. Now I say that, and I'll say, but for our purposes, I think there are things that we can do that are better for our time, that will address more of our long-term goals, that will actually get some change, physiologically. Like we go through that, but I do think it's important to not just flip people's worlds upside down or create like this line in the sand, because I think you lose people sometimes with that.
Yeah, I am guilty of that. I'll put that. I think sometimes my position is the strong one, and it does get misrepresented, but I am probably to blame a little bit for that as well. And the other thing that often gets thrown at me is that I'm saying that physios shouldn't touch their patients. And that's absolute bullshit, because I am a big believer of using palpation and touch in assessing and examining patients. And it means a lot to patients. The amount of patients that come to see me and say, well, the last guy didn't even ask me to undress, didn't even look at the bloody area. So I know it matters a lot to patients. So I like to examine thoroughly an area when I first met a patient. I like to go through palpation. All I know is that reliability of palpation means fuck all. Somebody goes, well, it's this spot here, press it here, that's where I feel it. And I do. And they go, oh, yeah, that's the spot. You've got the spot. What is that? And I'm like, that's a good question. All I can tell you, it's nothing serious. There's nothing hanging off, all right? There's nothing out of place. There's no deformity. There's no heat. There's no swelling. There's no discharge coming from it. I'm happy that it's just a painful spot. Well, what is that painful spot? Well, that's again, and then we go through the explanations that pain is, down to lots of factors, and it allows you to have that little window of education, I think, when you are using palpation and you do find a spot for them. What I find going wrong, though, again, is physiotherapists being taught that they touch things and they can feel these knots and these lumps, and they start to pathologize them when they're perfectly normal. The reason for doing palpation is to look for something that makes you go, oh my fucking God, what's that? Something that you go, that looks grossly swollen. I can feel heat coming off that. It's like a furnace, or that's sticking out where it shouldn't be sticking out. When it comes to this subtle stuff, that's where it all starts to unravel. That's where palpation all starts to go downhill and starts to be more nocivic and not beneficial. So, although I don't use manual therapy, I palpate patients. I touch and I examine them. And I'll also use my hands to facilitate movement as well in a session, in follow-up sessions as well. So, people will say, well, you're applying an MWM. I'm like, it's not fucking MWM. There's no specificity behind it. I'm not particularly pushing in any direction. If anything, I'm using it as an encouragement. I'm just saying, come on, this is the direction I want you to go. Come, follow me. Let me get the hands. Let me guide you there. And that's normally for these pain avoiders, the people that are backing away, that just need that little bit of, graded exposure, where you have to be a little bit more robust and say, look, come on, let me guide you through it. Let me take you through it. So hands on touching patients is important. It's just not fucking formalized manual therapy. That's all it's not.
For the 6 listeners that don't know what MWM, mobilization with movement, it's like a specific technique. You're just kind of guiding the movement and applying pressures and different vectors while the patient moves, but it's like courses are taught MWM. This is like
I think I spent about 2 weeks of my life learning all the different MWMs and directions and nags and snags and all that sort of stuff. So it was a combined nags, snags and MWMs course, and I just want my money back.
And so it sounds like your exam is not unlike what a typical exam would be. You're checking range of motion, you're palpating certain areas. It's more of the narrative behind what you're finding, potentially, that's maybe a little bit different.
Yep, and recognizing uncertainty about it and explaining that and passing that over to the patient. I think that's huge. That's the bit that I think physio doesn't do too well. It finds something and the patient goes, oh, what was that? And then it starts to pathologize it, and it starts to actually make it abnormal rather than reassuring people. Well, we're not quite sure, but there's nothing there abnormal. There's nothing there majorly problematic. It's just a hot spot. It is just a sensitive area. People don't like talking in those terms because it's too simplistic for them, and they think that's dumbing down. Doing things simplistically isn't dumbing down. Simple doesn't mean obvious. Simple doesn't mean dumbing down, and simple certainly doesn't mean easy. They're the sort of common misconceptions around simplicity that, again, on my courses and on the webinar, I'm going to try and prove that actually that's a lot harder to do this. Trying to give patients the reassurance that it isn't something serious, that it isn't a pathology, and it is a normality. It's challenging. It's hard. The easy stuff is to say to a patient, it's a trigger knot or a trigger point. If we stick a needle in it, that will sort it right out for you. That's definitely what it is. That's the easy bit. Trying to turn around to a patient and say, well, it could be this, could be that. It's not quite sure, but what we got to do is get you going and start moving on for the long-term picture, get this sort of situation under control, not keep looking at the sort of the short-term modification of your pain. Look at the long-term picture. That's the hard bit.
I also like what you're saying about the power of touch, but you use it in a slightly different way. So it's like back to your conversation about manual therapy. It does something. There is an effect. We cannot yet define the effect, and it's very non-specific, as at least how we can try to measure it now. But it sounds like what you're saying is you can get that same non-specific effect, which is essentially just the person being reassured that there's an expert who is working with them currently and who cares, and being touched by that expert just gives them that feeling that they're safe and that things are going to be okay. And so it sounds like what you're saying is that you can get that simply by like examining them, but having your hands on them, or even going through exercises and cueing them tactfully with your hands potentially. So that could be quote unquote manual therapy while they're doing an exercise and you're just there. Is that kind of what you're saying?
Yeah, kind of. I just wouldn't call it manual therapy because it's not, but you're right. It's reassuring touch, it's facilitation, it's encouragement, it's examination. It's just not formalized manual therapy. You don't need to go on a course to know how to do it. I think that's the key factor. Where you need to learn how to interact and communicate and examine patients, but you don't need to go on a specific course to know exactly which bot to press and which way to do it and which direction to poke and prod it. So that's what manual therapy tells us. That's what manual therapy tries to be, specific, and it isn't.